Meet Jane. She has postpartum depression. Jane is a 28-year-old woman who is uninsured, married, and a gravida 43113. She is 4 weeks postpartum with a history of depression and has called the office 3 times in the past week with concerns about breastfeeding, headaches, and insomnia. Upon exam, she is physically within normal limits except for cracked and blistered nipples. But she is tearful, exhausted, and overwhelmed with her third child. Against the advice of her midwife, she stopped taking her antidepressants during the last month of pregnancy because she felt it might harm the baby. Now she is afraid to be alone with her children who are 1 month, 2 years old, and 4 years old because all she wants to do is sleep all the time. PPD is depression suffered by a mother following childbirth. It typically arises from the combination of hormonal changes, psychological adjustments to motherhood, and fatigue. It is a serious problem that occurs in 10 to 20% of women who have recently given birth, but fewer than half of the cases are recognized. The presence of maternal depressive symptoms in the postpartum period has serious adverse effects on the infant and family. This includes marital distress, problems with mother-infant interaction and attachment, and adverse behavioral and cognitive effects in the child. Symptoms commonly manifest during the first 3 weeks after childbirth and can include sadness, loss of hope, trouble bonding with the baby, feelings of inability to care for the baby or do basic chores, decreased interest in food, sex, and self-care, or sleeping more than usual. The microsystem is the most influential part of the healthcare system because this is where direct one-on-one contact occurs with clinicians and patients. For Jane, this includes the prenatal care clinic, the delivery environment, a pediatrician's office, and any follow-up appointments for her. The nurse's roles are to interact with and assess the patient, screen at each visit with the mother, provide therapeutic interactions, develop a plan and involve her family, provide education to the patient and the family, and provide counseling as necessary. Jane first started her journey at the prenatal clinic where they screened her for postpartum depression. After the baby was born, her pediatrician and healthcare providers continued to check in on how she was doing after the birth. Her healthcare providers recommended that she reach out to family, support groups, and other community resources to help cope with PPD. The mesosystem consists of interactions between a person's microsystems. Some examples include structures and framework of the health system, connections between the prenatal clinic, hospital and outpatient services, community outreach, communication channels, access, internet support, and friends.